Welcome back to a new episode of Ask the Patient Advocate podcast. Today, we're having an important conversation about mental health support for older teens and young adults, a group that often falls through the cracks during a really pivotal time in life. I'm joined by Rachel Hyman, a licensed clinical psychologist who works closely with teens, young adults, and families to help them navigate anxiety, depression, grief, and trauma. So, thank you so much for joining me today. Dr. Hyman, welcome to the show, and we're so glad to have you here.
Thank you so much for having me.
Of course. So, maybe a good place to start would be to kind of tell our listeners a little bit about your background and sort of what led you to focus your work on older teens and young adults specifically.
Sure. I'm a clinical psychologist. I've been practicing for over 20 years, and I've worked with a whole variety of different age groups and populations in a lot of different settings. And I found that I really enjoy working with teens and young adults, as the stage in their life is one of exploration and growth and change. And it's so formative, and they're going through, so many major life transitions. I really enjoy helping them through this process, especially when it can be really confusing and difficult. And it can be really helpful to have a neutral person in one's life, just to be able to talk things through. So that's kind of how I really became interested in working with that population.
That's wonderful. I think it's a really important group because, we've had a few different psychologists on that kind of specialize in different areas or different age groups and so forth. But, the young adults and teens, that often is a lot of times when their health kind of changes as well, like their physical health and so forth. And so a big component is the mental health challenges. And sometimes that's kind of overlooked. So I think it's really important to sort of highlight that today.